Hi everyone, I'm Dr. Divya Shanthi and welcome to NEET PG Core Revision series. These series are structured, focused and exam oriented so that you can recall faster and more confidently in your exams. And in today's session, we are going to discuss the anatomy of pharynx. And we are going to break down it into clear, high-yielding, exam-oriented concepts. So let's get started. So the pharynx is a, what do we mean by pharynx? Pharynx is nothing but a musculomembranous tube. So from where to where is it extending? From the base of the skull up to the level of C6 vertebrae, okay, cervical vertebrae. So it extends up to that level. And here it is situated, when we see it is situated between, behind the, we have the nasal, the oral and the laryngeal cavity, okay. So between these three cavities and the larynx it is located. So accordingly we call those part of the pharynx as nasopharynx, the oropharynx and the laryngopharynx. So the length of this pharynx, okay, so the length of the pharynx is about 12 to 14 centimeters. And the width, the maximum width which we see in the nasopharynx, okay, in the nasopharynx it is more wider, which is about 3.5 centimeters. And at the pharyngoesophageal, okay, where it continues as the esophagus, below the C6 level, there it is the narrowest part. So there the width will be about 1.5 centimeters at the pharyngoesophageal junction. So here the pharynx, when we see, okay, so above it is here, it is superiorly, it will be supported by the body of the sphenoid. So this is the sphenoid bone. Okay, so it is supported by the body of the sphenoid and the basilar. So this is the basilar part of occipital bone. And below it becomes continuous. Okay, so here if you see at the level of, so this is C1, C2, C3, C4, C5 and C6. So here at this level it becomes continuous with the esophagus. So this will be the esophagus where it becomes continuous below. And in front, if you see here, it will communicate, okay, here it will communicate with the nasal cavity through the choanae, okay, through the choanae, that is at this part, it will communicate with the nasal cavity. Then through the oropharyngeal, okay, so at this point through the oropharyngeal isthmus, it will be communicating with the oral cavity, and near the laryngeal inlet, at this point here, it will be communicating at the laryngeal inlet, it will communicate with the larynx. So that is its relations anteriorly. And behind, if you see, it is supported by the upper 6, okay, so here the upper C1 to C6 cervical vertebrae along with its intervertebral disc. Okay, and in front of that there will be pre and paravertebral muscles which are covered by the prevertebral fascia. So all of them will be the relations posteriorly, and between that there will be a space which we call it as the retropharyngeal. Retro is behind, retropharyngeal space. And on each side, okay, and on either side laterally, it is related to the styloid process. Laterally or on the each side, it will be related to the styloid process and the styloid group of muscles. So from the styloid process, we will have three muscles: stylohyoid, stylopharyngeus, styloglossus muscle coming. So it is related to these muscles as well as to the carotid sheath with its content. So what are the contents within the carotid sheath? We have the carotid arteries, we have the internal jugular vein as well as the vagus nerve. And it is also related, okay, it is also related to the lobes of the thyroid gland, to the lateral lobe of the thyroid gland, the lateral wall of the nasopharynx, okay, the lateral wall of the nasopharynx will be communicating. That's a very important communication. It will be communicating with the tympanic cavity, that is the middle ear cavity, through the auditory tube. So that is about its external relations. Now we will study one by one. So here we have the first part of the pharynx, that is the nasopharynx. Behind it, this is the nasal cavity. So behind that we have the nasopharynx. Here, this portion is the oropharynx. Okay, this portion is the oropharynx, which is behind the oral cavity. So this is the oral cavity. And here we have the larynx. So behind that, this portion is the laryngopharynx. So briefly about the boundaries here. So the nasopharynx is situated behind the nasal cavity, and above this is the soft palate. Okay, so here we have the soft palate. So this portion is the nasopharynx. So I will tell the boundaries of nasopharynx again. Before that, let's finish with the oropharynx and laryngopharynx. Then we'll go to the nasopharynx, because nasopharynx has many important features which is important for the exams. So here, so the oropharynx, here we have this part. This is the oropharynx. Which is located behind the oral cavity. So here in front we have the oral cavity where it communicates to the oropharyngeal isthmus. This is the oropharyngeal isthmus through which it communicates with the oropharyngeal isthmus, to which it communicates with the oral cavity, and posteriorly here it is in relation to the bodies of, okay, so posteriorly it is related to C2 and C3 vertebrae, okay, C2 and C3 and the contents of the retropharyngeal space in that region. So posterior relations are those. And below it will be communicating with the laryngopharynx, okay, at the level of upper border of epiglottis. So here we have the epiglottis. So at the upper, so at this level here it will be communicating, okay, this is the epiglottis. So at that level it communicates below with the laryngopharynx. So the lateral wall of the oropharynx here, okay, so lateral wall will be having one tonsil which we call it as the palatine tonsil here. So palatine tonsil is located in this part, that is in the tonsillar fossa, which is bounded in front by the palatoglossal arch, which contains the palatoglossal muscle, and behind by the palatopharyngeal arch, which contains the enclosed, okay, so it is the mucous membrane covering that muscle, that is the palatopharyngeal muscle. So that is the boundaries of the oropharynx. The laryngopharynx, when we see, which is otherwise also called as the hypopharynx here, it extends from the upper border. So from this level, from the upper border of the epiglottis up to the lower border of cricoid cartilage. So this is the thyroid cartilage, and the first cartilage here which we see will be the cricoid cartilage. So up to this level we have the laryngopharynx. So behind it is supported by C4 to C6 vertebrae. Okay, so C4, C5 and C6 vertebrae, they form the posterior relations there. Okay, C4 to C6 vertebrae. And the anterior wall will be communicating, anteriorly it will be communicating to the larynx, to the laryngeal inlet. So those are the boundaries there of the three parts of the, basically we studied the oropharynx and the laryngopharynx. Now let's look at the boundaries of the nasopharynx. So this is basically a coronal section which we can see. So this is the choanae, there are the posterior nasal choanae here, which we can see the posterior nasal septum we are seeing. Through this, in this region, we have the nasopharynx communicating with the, nasopharynx communicating with which one? The nasal cavity. And this portion here, this will be the oropharyngeal isthmus, through which it will communicate with the oral cavity. Okay, so this is the oropharynx region. And here, this is the epiglottis here. This is the laryngeal inlet. So at this point, we will have the laryngopharynx. So this is basically how we will see when we take a coronal section of the pharynx. Anteriorly, we see these structures. So first, we will study the boundaries of the nasopharynx and see the important features in the nasopharynx. Okay, so this is the nasopharynx. So the nasopharynx is basically the portion of the pharynx which is located behind. So this is the nasal cavity. So behind this, whatever we are seeing here, this portion is the nasopharynx. Okay, so above, so the roof and the posterior wall, if we see here, it is formed. The roof is the body of the sphenoid here. Body of sphenoid along with the 𝗲𝗄𝗃, basilar part of occipital bone. Anteriorly, it communicates here with the nasal cavity through the choanae. Okay, and below it is bound by the soft palate here. Okay, so the floor basically is this portion, that is we call it as the pharyngeal isthmus here. This is the pharyngeal isthmus by which it will be communicating with the oropharynx. Okay, so this will be bounded in front by the soft palate. This is the soft palate. So the laterally, we will have the styloid process and the styloid group of muscles there. Okay, and we will also see some of the important features. So basically, these are mainly forming the boundaries. Okay, and posteriorly, we will also have the C1 vertebrae. Okay, C1 vertebrae we see posteriorly in this region. So this is the boundaries of the nasopharynx. So let's look at the features of nasopharynx. Okay, so here in each wall, that is in the roof, we see certain features. We see in the lateral wall few features. Okay, so we need to understand them well. So in the roof, okay, the roof as well as the posterior wall here, we will see an important tonsil here. Okay, which we call it. This is more prominent in children. So this is nasopharyngeal tonsil. So the nasopharyngeal tonsil, it gets enlarged, okay, because of some infection. When it gets enlarged, we call it as the adenoids. Okay, so that is in children, usually in children, and these adenoids, they obstruct the nasal passage. Okay, and that will lead to breathing difficulties. Okay, and usually those children, they will have typical faces which we call it as the adenoid faces, and they will be usually breathing through the mouth. Then here at this part, okay, so here in the posterior wall, there will be a small bursa which we call it as the pharyngeal bursa. Pharyngeal bursa, it is also called as the pouch of 𝗨𝗏𝗏. Okay, pouch of 𝗨𝗏𝗏. So it is nothing but a mucous diverticulum. Okay, so here it will be extending into the substance of the nasopharyngeal tonsil. So it will contain many mucous glands, this pharyngeal bursa. Then sometimes, okay, not always, sometimes we will see one more feature here, which we call it as the pharyngeal hypophysis. Hypophysis. Now, what is this pharyngeal hypophysis? We know that embryologically the anterior pituitary, okay, is formed by the rat case pouch, which pierces to the roof of the primitive mouth, that is the stomodium, right? So, this remnant of rat case pouch sometimes forms what we call it as the pharyngeal hypophysis. Then in the lateral wall, okay, so in the lateral wall we see few features. One is the pharyngeal opening of the, so this is the pharyngeal opening of the auditory tube. Pharyngeal opening of auditory tube, okay. Through this there is communication between the nasopharynx and the middle ear cavity. So that is why any infection, okay, in the nasopharyngeal region which will cause pain in the ear, okay, or infection can spread from the nasopharynx to the middle ear through this auditory tube, and that results in otitis media. So this is importance of this auditory tube here. And then we have behind that an elevation here, which we call it as the tubal elevation. Okay, so there is a tubal elevation. That tubal elevation is mainly caused due to the underlying tubal tonsil. Okay, so tubal tonsil is present beneath that. And behind here there is a recess here. So this recess we call it as the fossa of Rosenmuller. Okay, or pharyngeal recess. Fossa of Rosenmuller. These are the important features which we see it in the nasopharynx. So here all these tonsils which are present, they form an important ring which we call it as the 𝗙𝗕𝗏𝗏 ring. Okay, so 𝗙𝗕𝗏𝗏 ring. Now what is this 𝗙𝗕𝗏𝗏 ring? It is basically a circle of tonsils, okay, which are present. Okay, so when we say from anterior to posterior, so anteriorly there will be the lingual tonsil. Okay, lingual tonsil which we see it on the posterior 1/3 of the tongue. Okay, on the posterior 1/3 of the tongue we have the lingual tonsil. Anterolaterally, okay, anterolaterally here we will see the, that is this one, basically palatine tonsil. Then posterolaterally we will see the tubal tonsil, and posteriorly we will see the nasopharyngeal tonsil. So anterior, anterolateral, posterior, posterolateral, posterolateral and posterior here. So those are the things which we see, okay, around the oral as well as the nasopharynx, oropharynx, nasopharynx region, and they form a protective circle of tonsils. Okay, they are the immune system, they belong to our immune system, right, and they protect us through these, through openings. Whatever structures pass through has to pass through this guard before it enters the pharynx or the that is basically the nasopharynx or the oropharynx. So this we call it as the 𝗙𝗕𝗏𝗏 ring. Next, coming to the structure of the pharynx. So basically the pharynx, since it is a, how did we define pharynx? We defined it as musculo-membranous tube. Okay, so it has a muscle coat and a membrane covering that. So there we have the membrane, basically it is the mucosa, submucosa, the muscle layer and the protective areolar layer which will be on the outside. So the areolar coat, we basically call it as 4 coats: the areolar, the muscular, submucosa and the mucosal coat. So areolar coat, when we say, it is nothing but the buccopharyngeal fascia. So it covers the outer surface of the muscles, okay, outer surface of the constrictor muscles of the pharynx as loose areolar membrane. Then we have the muscular coat. So when we come to the muscular coat, okay, so here we will have the buccopharyngeal fascia. which covers the pharynx on the outside as a loose areolar coat. So the muscle coat, okay, so the muscle coat of the pharynx is made up of mainly the striated muscles. Okay, so that is the skeletal muscle, striated muscles, and these muscles, they are arranged in two layers, that is inner longitudinal and outer circular. So there is outer circular layer and inner longitudinal layer. Okay, so two layers the muscles are arranged, and the outer circular layer mainly consists of the three constrictors. Okay, so it is made up of these constrictor muscles, three constrictors, the outer circular. So we have the superior, middle and inferior constrictor. Okay, so they have the origin from the front and they get inserted. Okay, that is mainly from they take limited origin from the front, that is from the bones as well as from the ligaments. They have the origin, that is in front region, from the bones, the ligaments as well as the cartilages which are present. They have the origin from there and they all get inserted to the pharyngeal raphe. Pharyngeal raphe will be extending from the pharyngeal tubercle, that is at the base of the skull, near the 𝗍𝗄𝗏. It will be extending from there up to the 𝗕𝗵𝗄𝗏𝗔𝗟 junction. So up to that it will be extending to into which these muscles will be getting inserted. Okay, so each of the origin you did not remember for the NEET exams, so I will not be going into that details, but just mentioning the important features of these muscles. And in the longitudinal muscles, we have three. Thus from above downwards we have 𝗨𝗏𝗵𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏 nasopharynges. And then we have the palatopharynges. Okay, so originating from the styloid process, so from the lateral side of the tubal elevation, okay, just near the auditory tube, we have the tubal elevation, right? So it will be originating from there, and then the palatopharynges, which originates from the soft palate. Okay, so those are the muscles. So here, what most importantly you have to remember is, see now here, this is the base, so this is the pharyngeal raphe here, which is extending from the base here near the pharyngeal tubercle, near the base of the skull. So these are the constrictor muscles which we are seeing, the superior, middle and inferior, and inferior. So here the inferior muscle, you have to understand that it is arranged in two layers. Okay, so the inferior, it consists of two parts. The inferior constrictor will be having two parts. The inferior constrictor muscle, okay, will have two parts. Okay, so what are those two parts? It has the 𝗙𝗏𝗏𝗃 part and the 𝗏𝗏𝗏𝗃 part. So 𝗙𝗏𝗏𝗃 part, it has the origin from here. If you see, it has the origin here. Okay, this is the 𝗙𝗏𝗏𝗃 part, which will have the origin from the oblique line and the inferior horn of the thyroid cartilage. So from here we have the 𝗙𝗏𝗏𝗃 part. The 𝗏𝗏𝗏𝗃 part, as the name says, is arising from the cricoid cartilage. Okay, so it will be arising from the anterior arch of the cricoid cartilage. So here what you have to understand is the fibers of these 𝗙𝗏𝗏𝗃s, they run backwards and they will be getting inserted into the pharyngeal raphe. Okay, but whereas the fibers of the 𝗏𝗏𝗏𝗃s, right, they are horizontal in direction and they surround the upper end of the esophagus. Okay, they surround the upper end of the esophagus and they are continuous with the similar fibers from the opposite side. So here you can see them going around, okay, around the upper end of the esophagus. So because of this arrangement, so the upper part, that is the 𝗙𝗏𝗏𝗃s, will be obliquely running, going to the pharyngeal raphe, both the from the right side and the left side, whereas 𝗏𝗏𝗏𝗃s is going around. Okay, they run horizontally in a circular fashion and they circle the esophagus, the upper end of the esophagus, okay, and becomes continuous with the fibers of the opposite side. So here, because of that, there is a gap which is created, okay, which we call it as the Killian's dehiscence. So we'll be coming to that. Killian's dehiscence. Okay, Killian's dehiscence. So it is the weakest part of the junction between that. So you have to remember the junction between the thyropharynges and the crickopharynges is the weakest point of the pharynx, and it is known as the Killian's dehiscence. Right. So now these constrictor muscles, right, they are arranged like, since they have that overlapping arrangement, they look like one pot stacked into the other. Okay, and because of that, there is a gap, okay, between the base of the skull and the superior constrictor. There is a gap which we call it as the sinus of Morgagni. So this is the base of skull. This is the sinus of Morgagni. Okay, sinus of Morgagni. Then between the superior and middle, there is a gap here. And between the middle and inferior also there is a gap. Okay. So why this is important is there are certain structures which pass through these gaps. Gap between each of these constrictor muscles and within the sinus of Morgagni. So you need to be aware of the structures passing through that. So here if you see in the upper part, okay, near the sinus of Morgagni, okay, sinus of Morgagni, 4 structures pass through that. So what is the sinus of Morgagni? It is basically the interval between the base of the skull and superior constrictor of pharynx. So there in the sinus of Morgagni, okay, we will see 4 structures. And to remember those 4 structures, remember lap. Okay, with an extra A. So L is for levator velli palatini. Okay, L is for levator velli palatini. A is for auditory tube. The other A is for the ascending palatine artery. And the P is for palatine branch of ascending pharyngeal artery. Ascending pharyngeal artery. Okay. So these 4 structures, they pass into the sinus of Morgagni. Then between the superior and the middle constrictor, we have one muscle and one nerve which supplies that muscle passing through the gap between the superior and the middle constrictor. So here in this part, we will have the 𝗨𝗏𝗏 muscle and the glossopharyngeal nerve, which will be supplying that. Between the middle constrictor and the inferior constrictor, we have sin. Okay, that is what? We have the superior laryngeal vessels and the internal laryngeal nerve. Okay, so that passes between the middle and the inferior constrictor. And below the inferior constrictor here, okay, so these are the 2 parts of the inferior constrictor, these 2. This is both together. Okay, so this is the crico. Okay, this is the crickopharynges and this will be the thyropharynges. Here. So here we have 2 structures, that is RIN, that is recurrent laryngeal nerve, and inferior laryngeal vessels. Okay, so these are the structures passing between the gap between the constrictor muscles. So just to recall again, we have in the sinus of Morgagni the lap structures. What is lap for? Levator velli palatini, auditory tube, the ascending palatine artery and the palatine branch of ascending pharyngeal artery. Then between middle and the superior constrictor, we have the 𝗨𝗏𝗏 muscle as well as the glossopharyngeal nerve. Then between the middle and the inferior we have SIN, that is the superior laryngeal vessels and the internal laryngeal nerve. And below the inferior constrictor we have the RIN, that is the recurrent laryngeal nerve and inferior laryngeal vessels. So here I told you, now we have this 𝗓𝗏𝗃𝗃, that is the inferior constrictor muscle. Inferior constrictor muscle, which has two parts. Okay, so here you can see the two parts of the muscle. One is the thyropharyngeus. Another one will be the 𝗓𝗏𝗃𝗃. Okay, so because the thyropharyngeus will be running obliquely, so you can see them running obliquely and they get inserted to the median raphe. Whereas the 𝗓𝗏𝗃𝗃 muscle, they run horizontally and they become continuous with the fibers of the opposite side. Because of that, there is a gap here, okay, and this gap is known as the dehiscence of Killian or Killian's dehiscence, okay, Killian dehiscence. Okay, so this is very important now. Okay, so what happens is, now here the action of the constrictor muscles, when we take all the constrictor muscles, they contract, okay, reflexly during deglutition. Okay, so they are mainly responsible when we swallow the food during the deglutition, and they will induce, what is that, a wave of peristalsis, okay, so during the deglutition process in a caudal direction. So the thyropharyngeus here, the thyropharyngeus part of the inferior constrictor is propulsive in function. Okay, so it will push forward. Whereas the 𝗓𝗏𝗃𝗃𝗃, since it is around, it acts like a constrictor. Okay, like a sphincter. Of course, it is called a constrictor muscle itself. So since it is around, it acts like a sphincter. Whereas the thyropharyngeus will act like a propulsive muscle. Okay. So usually what happens during the deglutition process, it is kept closed. So when the thyropharyngeus contracts, then the 𝗓𝗏𝗃𝗃𝗃𝗃 will relax. When the 𝗓𝗏𝗃𝗃𝗃𝗃 contracts, the thyropharyngeus will relax. So basically they will have kind of opposite action, though they belong to the same muscle, that is the inferior constrictor. So now why this is important is in neuromuscular incoordination, okay, in neuromuscular coordination, okay, when both the muscles, so when there is neuromuscular incoordination, what will happen? Instead of one muscle contracting and the other relaxing and vice versa, both the muscles will contract at the same time. So what is happening? There is a lot of pressure there, okay. So the intrapharyngeal pressure will increase, okay, and the mucous membrane. So if you see, the mucous membrane of the pharynx will bulge between that gap between the thyropharyngeus and 𝗓𝗏𝗃𝗃𝗃𝗃, okay. So though in that Killian dehiscence, through that Killian dehiscence, we see the mucosal membrane bulging, and this we call it as the Zenker's diverticulum. Okay, so you have to remember that Killian dehiscence is the normal thing which we see, that is basically the gap, okay, between the 𝗓𝗏𝗃𝗃𝗃𝗃 and the thyropharyngeus. And Zenker's diverticulum is a condition occurring due to neuromuscular incoordination. Okay, so this, if it is progressive, it can result in dysphagia, okay, difficulty in swallowing. So that is the clinical importance of this. So here you can see that gap, right? This is just for you to understand. So this is the mucous membrane. So this is the thyropharyngeus part. And this is the 𝗓𝗏𝗃𝗃𝗃𝗃 part. So this gap is the Killian dehiscence. And this, when the mucus, when the mucous membrane bulges through that gap to the Killian dehiscence, we call it as the Zenker's diverticulum. Then coming to the longitudinal muscles. So longitudinal muscles, we have one coming from the styloid process, so that we call it as the stylophyllangeus. Okay, stylophyllangeus muscle, which comes from the medial surface of the styloid process. Then from near the auditory tube, we have the 𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙 Laryngopharynges, and from the soft palate here we have the palatopharynges. Okay, so they all form a conjoined tendon and they get inserted to the posterior border of the lamina of the thyroid cartilage. So you can see all of them getting inserted here. They get inserted to the posterior border of the lamina of thyroid cartilage. Okay, so here stylopharyngeus muscle is basically supplied by the glossopharyngeal. You have to remember this here, very important. The stylopharyngeus, the nerve supply is the glossopharyngeal, whereas the salpingopharyngeus and the palatopharyngeus, they are supplied by the cranial accessory nerve through the pharyngeal plexus. Okay, so this is supplied by the cranial accessory nerve, these two muscles, whereas stylopharyngeus is by the glossopharyngeal nerve. So let's see the nerve supply. Okay, so the nerve supply of the pharynx, here we have the motor supply as well as the sensory supply. So this is very important because it is a very common MCQ which is asked. So motor, when we say, okay, so the motor supply is all the pharyngeus, all the pharyngeal muscles, they are supplied by the cranial part of the accessory nerve. Okay, cranial part of accessory nerve through the pharyngeal plexus, through pharyngeal plexus, except for which muscle I already mentioned, except for the stylopharyngeus. Stylopharyngeus, which is supplied by which nerve? The glossopharyngeal. Okay, so stylopharyngeus alone is supplied by the glossopharyngeal nerve. And in addition to that, the inferior constrictor muscle. Okay, so the inferior constrictor muscle is also supplied by the recurrent laryngeal nerve. Okay, the inferior constrictor will also be supplied by the recurrent and external laryngeal nerve. So all of these, the nuclear origin of all of these motor fibers, there, that is in the nucleus ambiguous. Okay, in the nucleus ambiguous it is present. So sensory supply. Okay, so the sensory supply for the nasopharynx. Okay, so the nasopharynx is basically by, so when we talk about the sensory supply, next moving on to the sensory supply. Okay, the sensory supply of the pharynx now. Sensory nerve supply. So here we have three parts. The nasopharynx. The nasopharynx is mainly supplied by the nasopharynx. Okay, so the nasopharynx is mainly supplied by the pharyngeal branch. Pharyngeal branch of pterygopalatine ganglion. Of pterygopalatine ganglion. The oropharynx is supplied by the glossopharyngeal nerve, and the laryngopharynx is supplied by the internal laryngeal nerve. Okay. So these are the three things, mainly the sensory supply. And here these nerves, they form what we call it as the pharyngeal plexus. Okay, so pharyngeal plexus. Now this pharyngeal plexus is contributed by the pharyngeal branch of vagus, the pharyngeal branch of glossopharyngeal, then the branch from the superior cervical ganglion, superior cervical ganglion of the sympathetic trunk. Then sometimes a branch from the external laryngeal nerve also will contribute. The external laryngeal nerve, okay. So they form the, what we call it as the pharyngeal plexus. So these plexus, they lie on the buccopharyngeal fascia, covering the middle constrictor muscle. So what you have to remember here is the fibers which come from the vagus, no, they are mainly motor. The vagal fibers are mainly motor. The glossopharyngeal fibers are mainly, they are sensory. Okay, and the sympathetic fibers are vasomotor, that is, they supply the blood vessel, vasomotor. So that is about the nerve supply of the pharynx. Next, coming to the blood supply. Okay, so it receives blood supply by many arteries around that region. So the blood supply of the pharynx is by the ascending pharyngeal artery, then ascending palatine artery, ascending palatine, as well as tonsillar branches. Okay, tonsillar branches from the facial. Okay, here you can see the tonsillar branches coming from the facial artery. So here, facial artery, and then we have the greater palatine, the pharyngeal branch, and pterygoid branch. They are all coming from the maxillary artery, and there is the dorsal lingual. Here you can see posteriorly, this is the dorsal lingual, which is coming from the dorsal lingual, okay, which is coming from the lingual artery. These are all the tonsillar branches coming from the facial, tonsillar, and here we have ascending palatine here, okay, coming from the facial, and here we have all the branches from the maxillary, greater palatine, pharyngeal and pterygoid, which will be supplying the pharynx. The veins, they form a plexus, which we call it as the, this one, we call it as the pterygoid venous plexus. Pterygoid venous plexus, and they drain into the internal jugular vein. These pterygoid venous plexus are connected to the cavernous sinus, to the dural venous sinuses, to the emissary veins. So any retrograde spread of infection, okay, can take place through these pterygoid venous plexus. So usually from the dangerous area of the face, that is the nose part, right? The philtrum of the lip and near the septal region, which is drained by the deep facial vein, drains into this. So any infection is carried, goes to the pterygoid venous plexus, and from the pterygoid venous plexus to retrograde spread to the emissary veins. Because the emissary veins do not have valves, it can go to the cavernous sinus, causing cavernous sinus thrombosis. So that's all about the blood supply and venous drainage of the pharynx. Now let's solve some of the image-based MCQs. So what is the structure marked by the arrow at the opening? Okay. So here you can see this is the tubal elevation. This opening is the opening of auditory tube. Which muscle is primarily responsible for the action shown? Okay. So here what is the action is, basically it is pulled up here. Okay. That is 𝗕𝗵𝗶𝗏. The soft palate is pulled up, if you can see here, and this pharyngeal isthmus is closed. Okay. So this part. So that is the 𝗕𝗵𝗶𝗏 muscle. Which structure passes through the labeled gap? Okay, so the labeled gap is here. Actually, this is the gap. So what structures passes? What is the gap between the superior constrictor and base of the skull? It is the sinus of Morgagni. So we have the auditory tube passing there, correct? Lap. Among the lap, we have the correct choices here. Glossopharyngeal nerve, it is between the superior and middle. Stylopharyngeus along with glossopharyngeal between superior and middle. Internal laryngeal nerve will pass between the middle and the inferior constrictor. Laryngoscopic view showing a depression lateral to laryngeal inlet. Okay, that is the pyriform recess where a foreign body can lodge. Which nerve is most likely to be injured? Okay, so here it is supplied by the internal laryngeal nerve. So internal laryngeal nerve is most likely to be injured. So pyriform fossa, we see it on either side of the epiglottis, between their epiglottic fold and thus we see the pyriform fossa here, where the foreign bodies, usually the fish bone and all, gets lodged. Coronal section showing palatine tonsil in the tonsillar fossa with the vessel running close to its lateral surface. Which vessel is most at risk during tonsillectomy? So tonsils are supplied by the tonsillar branches from the facial artery. So the facial artery is more at risk. So alright, so that's a wrap on today's session of pharynx. Consistency is the key to success. So be consistent with this series and I will see you in the next session.